Good afternoon, everybody. I'm a little early today. I usually get to y'all in the evenings, but it's almost summertime and I want to be outside in the evenings when the sun is going down and it's cool. But I am excited to chat with y'all tonight. As you come into the virtual room, tap in and post in your comments where you're joining from, your city, your state, your province, your country, whatever you'd like for me to know. Just let me know where you're joining us from, as it definitely helps me with the conversation, a conversation starter, gets the conversation going. I'm Dr. Macie Smith. I am your social gerontologist, helping you and your families reach the next level of care. If you are caring for someone living with Alzheimer's or dementia, or you're caring for a senior, I provide tools, tips, strategies, and tricks to help you reach the next level of care, whatever that may look like for you. I'm not specific to dementia. However, I do specialize in coordinating care for those living with dementia and their caregivers, which is vitally important. You cannot leave the caregivers out when you're coordinating care for a senior and or someone living with dementia, because how many of you know that it is not the person living with dementia, it is the family living with dementia. So I am very intentional in wrapping services around the entire family, because it is a family condition that's going to require a family level of support, and in many cases, a community level of support. Chiming in from Baton Rouge, Louisiana. Hey, Pat, how are you? How's the weather there? I know that's like a cliche. How's the weather there? But how is the weather there? I'm here in South Carolina, so it's teetering between low 80s, and this week we're going to get into the high 90s. And I don't think it's summer yet. I think we're still on spring. So as you're coming into the virtual room, just drop a line and let me know where you're joining from. I am excited to talk with y'all this evening. Get your questions ready. If you have questions, if you have comments, if you have criticisms, I take those too. I love constructive. That's the key. Constructive comments. Some of y'all ain't constructive. Some of y'all just mean and nasty, but most of you all here have just been a blessing to this community. Many caregivers are looking at your comments, your recommendations, your suggestions, your strategies, your tools, your tips, what's worked for you. And that's what I was hoping for. I was hoping to build community when it comes to my YouTube channel, Just Ask Dr. Macie. But just don't ask me, ask the community. How about that? Pat, is hot. Okay. I believe you. I hadn't been there yet, but I believe you. All right. June is Alzheimer's Awareness Month. And I want to talk with you all tonight about just, the nuances as it relates to Alzheimer's treatment. Unfortunately, where it stands today, there is no treatment, there is no cure, there is no 100% preventative strategy regarding the development or the diagnosis of Alzheimer's disease. Although there's not a cure, there is care. There is your care. And so my only job really is to provide you all with information, education, guidance, and direction as it relates to your caregiving journey, what that looks like, and how I can support you with those tools, tips, strategies, and techniques along the way. So if you have any questions, please drop them in the comment section. I will be answering them throughout this live. Now, let's talk about the treatment for Alzheimer's disease. There is one Alzheimer's treatment. Actually, there are two Alzheimer's treatments that are designed to slow down the progression of Alzheimer's disease, the disease in the early stages. And the key term here is in the early stages. You have to know that the person is dealing with Alzheimer's in the early stages, because memory loss, we're all going to deal with memory loss and forgetfulness and confusion as we age. How many of you have forgotten where you put your glasses and they're on your face? How many of you have forgotten where you put your cell phone and you call in your friend to say, hey, have you seen my cell phone? And you're calling on it, right? That's happened to all of us. Don't worry. You good. You good. It's typical. It happens if we're stressed, if we're focusing on other things, and we're just going to forget things. There are going to be things that just not going to stick out to us. It's not going to be significant enough. It's not going to be important enough. So we're just going to leave it in the short-term memory, and then it's going to fade away. It's not going to make its way to the back of the brain. So if you are alarmed because you or a loved one has been forgetting, don't let that alarm you to the point where you're ready to, accept the diagnosis of dementia or Alzheimer's disease. There could be a reasonable explanation as to why the person is forgetting. There are treatable causes of dementia symptoms, the forgetfulness, the confusion, disorientation to time and place. One of those things could be medications. Medication side effects and medication interactions. A lot of our seniors are dealing with several different doctors, and these doctors are prescribing different medications for the same condition. When that happens, that could cause dementia like symptoms. It's not a progressive type of dementia, it's not Alzheimer's disease, but it is showing up as dementia symptoms as a result of the medications, medication side effects, medication interactions. Are those medications fighting against each other? What are the side effects? And I will tell you, when you get the leaflet from your pharmacy and it lists the side effects of the medications, please read it. But I want to warn you that seniors, those over the age of 65, may not present with the typical side effects that are listed. The person may present with headaches or nausea or insomnia. Those are all side effects. So if it's not listed, don't assume that it's not a side effect, because it could be. Again, when they're over the age of 65 and they're a senior, their side effects may not present as typical side effects that you would generally see in the general population. So be mindful of that. Another treatable cause of dementia could be a urinary tract infection or an acute illness. It shows up just like full blown dementia or Alzheimer's. If that urinary tract infection has not been treated and it's infected the person's system and they become sepsis, right? Another treatable cause of dementia symptoms could be depression. It could be untreated diabetes. It could also be lack of sleep. If you're not getting that 7 to 9 hours of sleep, you could show up confused, disoriented, not being able to make proper judgment, not being able to think thoroughly through things. And it may also affect your ability to communicate effectively. But if you would go to sleep and sleep well, get your required number of hours, then you may see that those symptoms may subside. There's some other causes. A person could actually be having a stroke. They may not even realize it. The people who they're talking to may not even realize it, but they could have been having a stroke, which could have caused the forgetfulness, the memory loss, and also delirium. We got to keep in mind that delirium and dementia are two different things. They look similar, but they're two different things. Dementia tends to come on gradually. If it's a progressive type of dementia, it's going to come on gradually. It's going to come on in stages. The full range of stages could last over a period of 20 years or more. Delirium is a sudden state of confusion. So this morning, the person was sharp, clear minded, no issues at all cognitively. But by the afternoon, they're severely confused. They're not understanding where they are, who you are, the time of day. That is delirium. That could be because of a urinary tract infection or an acute illness. It could be as a result of a fall. And so you want to keep that in mind. If the person is becoming confused and forgetting a lot over a short span of time, then that could be delirium. All of these areas should be addressed by their primary care doctor. If you have a concern with it, then it is a valid concern that you want to check out with the person's primary care doctor, not the hospitalist. I don't recommend my people going to the hospital unless their left arm is cut off. That's an exaggeration. That's an exaggeration. If you feel like it's an emergency and you need to get there, you need to get there. But if it's something that can be treated at the primary care doctor's office, then I would recommend that, because a hospitalist is not the person's primary care doctor. That is a rotational physician that comes in and out of the hospital. So what that means is that that doctor does not know that person's history. That doctor does not know that person's health history. And so they're going to treat the person based on what they see. A lot of times they don't even know their allergies and what they're allergic to. They don't know those chronic illnesses that they may have that's not communicated by the person themselves or their family member or caregiver. And so you want to be very careful and cautious if you have to take your loved one who's over the age of 65 to the hospital. Again, if it can be treated at the primary care doctor's level, then that's the most ideal way. Um, so those are the treatable types of dementia. So those areas, again, can be treated or addressed, and you should see those symptoms subside. But if it's full on Alzheimer's disease or Alzheimer's related dementia, right now, there is no cure. One of the treatments that the FDA has approved to treat Alzheimer's disease in the early stages, the treatment is not to cure it or to put it in a holding pattern to whereas it doesn't get any worse. The treatment is designed to slow down the progression of Alzheimer's disease for people in the early stages of Alzheimer's disease. So you have to catch it in the early stages. The physician has to catch it in the early stages. So you got to know the difference between what's normal aging memory impairment and what's full on dementia related memory impairment. One of the ways to determine that, which it can be very difficult, number one, you have to know the person. You have to know their history. You have to know their personality. You have to know their characteristics to know what is uncharacteristic for them, right? So, say, for example, my mom, if she calls me my brother, I don't have no concern with that at all because she has always called me my brother's name or my sister's name from when we were smaller. That's not different for her. That's not different for her. Now, somebody else may come in and say, oh my gosh, she called her by her brother's name. What's going on? Well, nothing's going on because she's always done that. So that's not new for her. So better understanding your loved one and what is typical and routine for them and then what's not. And so when that forgetfulness or memory loss or inability to make good decisions begins to affect their life, begins to affect their daily routine, then that could be early stages of dementia. For example, we've all forgotten where we parked our car at the grocery store. We find our car after we walk around for a little bit. The other day, I got turned around in the parking lot at the Kroger. And I hate going in the Kroger because the Kroger is so cold. Like every part of that grocery store is freezing for no reason. I'm not even in the freezer section. Why is it cold? That's why I wear sweatshirts to the grocery store. But I do not like going in the Kroger because it's too cold. Well, they had a sale the other day on Dunkin' Donuts coffee. And I love me some Dunkin' Donuts coffee, the Keurig cups. They can be quite expensive. And so I went in Kroger. For those of you who go to Kroger, you know that Kroger has about 5 entrances and exits. And I went in one and came out a whole different one. And I walked around that parking lot for a good 5 minutes. Was I a little embarrassed? Yes, I was. However, I didn't know where my car was. And so I was backtracking, retracing my steps, thinking back to what direction I went into the store, which door I may have gone into the store, and I backtracked. I was hitting my button on my key fob. That wasn't working. So obviously my husband did not change the batteries. So I got to get with him about that. But eventually I found my car, drove home. I'm good. If it's considered a possible situation where it may be early stage dementia, the person can't find their car and it takes them a really long time, like maybe hours, to find their car. When they find their car, now they're turned around on how to get back home. And they've lived in this house for 15, 20 years. That could be a sign that the person may be dealing with early stages of dementia. Now, before we even get to early stages, there's MCI, mild cognitive impairment, and that's when a person is forgetting more often than the average person their age and their condition is forgetting, and it's impacting their life. But it's not dementia yet, and it may not ever be dementia. It could just be mild cognitive impairment. And if it's just mild cognitive impairment, and I don't want to say just because that's not something to just kind of toss out there. If it is MCI or mild cognitive impairment, the person could make healthier lifestyle choices such as eating well, sleeping well, making sure they're engaged and learning new information and being around people, ensuring that the four domains of their overall well-being is addressed. Then you may see that it doesn't go any further than MCI, and then that MCI may, improve because it was because of lifestyle factors that the person was um, actually dealing with this level of impairment or experiencing it. And so now this person is having trouble doing things they've always been able to do. This person is now having trouble remembering dates and times and appointments that they've never forgotten, such as going to Bible study every Tuesday night for the past 10 years at the same place, or going to the community center every Thursday at 10 a.m. Been doing that for the past 15, 20 years. Now, if you see that person is beginning to forget those things that they've never forgotten, that could be considered early stages. You want to get to the primary care doctor. And so if the person is determined to be in early stages of Alzheimer's disease, after there have been a multitude of tests from the neurologist, brain scans, and from the primary care doctor, which would be blood tests and cognitive assessments. Typically, the neurologist would do the cognitive assessments, the neurology office, because it's usually a geriatric psychiatrist now that does the cognitive test, but sometimes the primary care doctor will do a cognitive test as well. So I make those comparisons, and you make a determination that the person is indeed in early stages of Alzheimer's. Now you got to find the doctor that actually administers the infusions, because it's not a pill. It's not a liquid that you take. It is an infusion, and it is a monthly infusion. I'm talking about the lecanemab, the medication or the treatment that has been FDA approved to treat early stages of Alzheimer's disease. It does not change the trajectory or the course of the disease process, but it has it's said to slow the progression of the disease down. And what that does is that promotes longer quality of life for the individual, not only for that individual, but also for the family that's providing the care. Now, you've determined that the person is in early stages of Alzheimer's. Now you have to locate the doctor. Now you located the doctor that's going to do the infusions, which it's not a lot of doctors out here, but there are some doctors. And what was hoped to have been found was that it would show marked improvement in terms of uh, a person's cognitive ability. But what clinical researchers are finding out now is that it is not showing marked improvement, but it is showing modest improvement. So some people have improved in terms of, and when I say improved, in terms of not progressing, right? I might forget your name, but I haven't forgotten who you are to me. But again, it is some modest improvement. They were hoping that it would be more. But as of right now, and what the data supports is that it's modest improvement. But any improvement in the fight to end Alzheimer's disease is a win for me, and it is hope for all families and families to come. And so we want to continue to have conversations about it, continue to ask questions, continue to be present, and be open to having a conversation. A lot of times we shun the idea, number one, that our loved one is even dealing with Alzheimer's disease. We don't want other people to know. We think that it looks bad on us as family members and caregivers, but what that does is it pushes caregivers into isolation. Caregiving is already an isolating role if you allow it to be. But if you don't talk about it, and if you don't share with other people, and you don't connect to resources and support groups, you are increasing your risk as a caregiver of dealing with depression, because you're isolating yourself. You do run the risk of depleting your quality of living, and that's going to ultimately negatively impact the type of care and the level of care you provide to your loved one. All right. Any questions? Please post your questions in the chat, and I am going to get to them as I go through the live after I plug up my computer. Thank you for staying with me as I plugged up my computer. All right. So, um, Kelly's question is: my husband was diagnosed with FTD, and that is frontal temporal dementia, at the age of 58. He is now 60. Kelly, sending blessings to you and your husband. Um, FTD is a different type of dementia. Alzheimer's is the number one type, the most common type. FTD is the fourth most common type. Typically, you would see a full range of emotional changes with someone with FTD and concerns with executive functioning, meaning being able to make good decisions and make choices about different things. And that is early. That is early because typically someone is diagnosed with Alzheimer's or a progressive type of dementia after the age of 65. If someone is diagnosed prior to the age of 65, that is considered early onset Alzheimer's disease. And we typically see, Kelly, that disease progress a lot faster than if someone was diagnosed after the age of 65. And so I am hoping that you have your advanced care directives initiated and executed, which would be your power of attorney, your durable power of attorney, your healthcare power of attorney. Not a real fan of living wills, but if that's what you got, you want to make sure you have that in place. And also maybe 5 wishes. That's also another advanced care directive. Be sure that you are connected with the Association for Frontal Temporal Degeneration. That's AFTD. If you have not connected with them, please do so. I want you to Google AFTD. They have amazing support groups. They have amazing resources. I've actually done a couple of videos with some of their ambassadors because that is a type of dementia that people don't talk about a lot. We see it now in the news more so because of Wendy Williams's diagnosis or initial diagnosis and Bruce Willis's diagnosis. It can definitely be challenging. Um, but it is going to be work, but there are beautiful moments along the journey. He doesn't think anything is wrong. And that's okay, Kelly. That's okay. I don't want you to force him to accepting that he has frontal temporal dementia. Really and truly, it's for you to know. He doesn't have to know. He doesn't have to accept it. I feel like he does know, but he's not prepared to accept that. And that's okay. I want you to continue along your day in as normal as in as normal way as possible. You know, you want to incorporate normalcy in the day to day, right? You don't need to remind him of what he has. You don't need to remind him of what he can't do, but you will have to eventually prepare the environment to support his independence. And you're going to need support. You are going to need to lean on spouses who are currently going through it, spouses who have already been through it. So that way you can have your support needs met as well. And that's why I'm recommending the AFTD. It's hard because we were just starting our empty nester life. Oh my gosh, I totally get it. Um, but you know, I'm a woman of faith, and I'm not going to tell you as the elders would always say, you know, the Lord won't put more on you than you can bear. I'm not going to tell you that, but I believe that you will be astute enough, right, to ask for help and to accept help because you're going to have to have it. If you don't, then what we know now is that approximately 35% of family caregivers actually pass away before the person with the chronic illness. And I will tell you, there are going to be some very much emotional roller coaster. So, connecting with AFTD, are you connected with them now? Let me know if you're connected with them now. they're going to give you the resources that you need. I mean, I can drill down on, several different things. You're going to see behavioral changes due to the emotional imbalances, because it is a neurological condition. And the frontal lobe and the temporal lobe, that's where your emotions are, that's where your decision making is, that's where your memories are. And so all those things are being attacked at one time, right? The whole temporal lobe isn't gone, and the whole frontal lobe isn't gone. However, parts and pieces are dissipating. And so you really have to ensure his quality of life for as long as possible, but by ensuring your own sanity, right? Don't leave yourself out of it. It is not selfless to ask for help. It is very much no, I'm sorry, it's not selfish to ask for help. It is selfless, because you have to put yourself first. Because who's going to take care of him if you're not strong? Right? And I'm sure you're gonna have to be the anchor. But my mom would always tell me, even steel wears out. So, you can be strong, but only for a moment, right? You're gonna have to have your outlets to, whereas you break down, whereas you cry, whereas you actually express your emotions in a safe space, and then you get back at it. Tap into in-home care. So you want to look at licensed home care companies. I'm not sure what your resources look like. I don't know if your husband is a veteran or not, because there are VA benefits. There are also vouchers that you can get from the Department on Aging to help pay for some respite options through the licensed home care companies. But reach out to AFTD, so you're not connected yet. So after this call, I want you to go online, Google AFTD in whatever city and state you're in, so that way you can go ahead and get that connection. Be proactive with it. They're going to teach you even the simplest things as how to communicate with him. Like I was telling you, don't force the reality on him. When someone has dementia, I am not a fan of reality orientation. Why are you forcing reality on the person? What is that going to do for them? What is that going to do for you? You think it may be helping in the interim or in the moment, but it's gonna boomerang, because number one, they're gonna forget what you said. Number two, it's probably gonna aggravate them or incite more challenging behaviors, because that's not something they're ready to accept. So you really do have to practice as much normalcy as possible. Go with the flow, pick your battles, and prepare the environment as the disease progresses. And you, my dear, are a part of the environment, but I want you to get those supports in there. Anybody else have any questions? Any questions about caring for your loved one with dementia, with Alzheimer's disease? Any questions about connecting to resources or supports? Every county has an area agency on aging. We call them the AAAs. Now, in different states, they may be called something different, but it is an arm of the Department on Aging. That's where you can get respite vouchers for those living with dementia. In South Carolina, they award up to $1,500, depending on if they still have the funding left, if it's the beginning of the fiscal year, the end of the fiscal year. They also connect you with senior centers. Senior centers are woefully underutilized. That is an amazing form of respite at no cost to you, but you need to get connected through your AAA, Area Agency on Aging. They also offer Meals on Wheels. Um, now, depending on where you live, sometimes the Meals on Wheels look pretty good. Sometimes they look a little suspect. I'm just saying. But most times, the Meals on Wheels is a great option and a great resource, not only for the person to get sustenance, but also someone is actually bringing the food to their door. And so that's going to be some form of engagement for them. So they'll have company for, a couple of minutes or so. They look forward to that. And in some cases, I've had the Meals on Wheels people actually recognize an emergency, because they would come every day the same time, and the senior would come to the door every day the same time. They'll have their chat. Well, this particular day, the senior did not show up to the door, and the driver was concerned, and he called the office, the AAA, and then that office made a call to the person's daughter, and that senior actually had fallen. and did not have a way to communicate with anyone. And because of that Meals on Wheels driver being a part of the community, being a part of that person's wraparound services, they were able to identify an emergency. So we're praying that that does not happen often, but that is a form of engagement, sustenance. That AAA can also, in some cases, provide you with information on transportation. Some caregivers are in the sandwich generation. They're working, they're taking care of their children. They're not caring for their senior 24/7 because they can't. And so that is an option. So when you get connected to your AAA area agency on aging, ask for the services and supports that they may have. And a lot of times you might not even know what to ask for. Just describe it. If you're tired, when you call, just say, I'm just tired. My mom is 70 years old. She has dementia and I'm tired. I need some help. And they will actually provide you with all the services that they provide and then start that particular journey. And those services are typically at no cost to you. And in fact, as I stated, many of them have the respite voucher where you can actually, the check could be cut to the senior and you could actually pay a family member to provide care. You can pay a licensed in-home care provider to provide care. I do a lot of work with Synergy Home Care. Synergy is all over the country. They do very well with training their staff on providing dementia dementia competent practices and dementia compassionate care. But you can actually, invest in any licensed home care company. That's just the one that I work with a lot. Also, if you didn't know this, but you can also request respite and actually provide your loved one respite in an assisted living as well. So respite doesn't necessarily have to be provided in the person's home or in your home, especially if you don't know if it's time to look for out of home placement and you don't know what options are out there. You can possibly do a respite stay, maybe, a couple of days, one day, a couple of days, a week at an assisted living that you think might be a good fit for your loved one. And so you can pay, the AL assisted living to do respite, or you can use the voucher that you get from the AAA to pay for a couple of days of respite in the assisted living. And that way you can spend some time at home. Like sometimes you know how like you take off work, you take vacation, but you don't go anywhere. Like that's the best vacation. I'm gonna take off work because I just want to be at the house doing absolutely nothing. And if your loved one is at the house with you, you're gonna be doing something, even thinking about them. That is still a level of care. And so that is something that you want to be mindful of as well. Hey T Legend, how are you? I just described how you feel, just tired. I'm from the country, so we just say tired. We just tired. Don't even know what you need. You tired. That's what you need. You need relief from being tired. And when they say, well, what do you need? Then you just say to them, well, what you got? So I will say that in my book, A Dementia Caregiver Call to Action, I do list several resources in the back of the book. And I actually tell you who to call and what to say, what to expect. And so that'll be a great starting point for you. The book is available any and everywhere you get your books. If y'all don't have any more questions, I'm going to wrap up for tonight. I will let you know that I will be live and in a physical building. I'm in Atlanta, Georgia, actually McDonough, Georgia, June 26th. If any of you are in Georgia, near the Atlanta area, or if you have loved ones that are in the Atlanta area, I will be at Story on the Square June 26th. That's a Thursday evening at 6 p.m. It is a free event. Tickets are going swiftly. So if you're in the area, if you know someone, please go to Eventbrite and just Google my name, Dr. Macie Smith. It's called An Evening with Dr. Macie Smith. And we're doing a dementia care discussion, a book discussion, and then we're going to go right into a book signing after we do a Q&A. So it's free and open to the public. I want people to come with their questions, with their concerns. We have resources in the building. I'm answering everybody's questions to the best of my ability because we have to build community around our loved ones living with Alzheimer's and dementia. Hey, Valerie. Valerie, you said IHSS, please. What is that? I don't know that acronym. What's IHSS? I might be telling my age now, huh? All these acronyms flying around. A coworker that has IHSS told me that this new administration is cutting help for all types of care, even outside of. Oh, is this Health and Human Services? So in South Carolina, it's DHHS, Department of Health and Human Services. So I'm wondering if that's what your acronym is. If you can just clarify that for me, and then I can speak on that. Yeah. So some elements and areas of Medicaid is on the are on the chopping block. However, as of today, the services appear to still be in play. But it is the end of the fiscal year too. The beginning of a typical governmental fiscal year is July 1 to June 30th. So I don't know if this is strategic. I don't know if the cuts are going to pass both the House and the Senate. I don't know the brevity of the cuts, but I do know that come July 1, I want all of y'all to reach out to your AAA, your area agency on aging, and apply for those vouchers because they might get cut. You just don't know what's going to happen. Um, and those vouchers are not coming from Medicaid. However, it is coming from a federal grant. Um, Now, if a person has Medicaid, they qualify for community long-term care and the Medicaid waiver, which will pay for in-home services and supports. It will pay for someone to come into the home. It will pay for out-of-home placement in a nursing home. It still doesn't pay for assisted living unless that particular assisted living does accept state-supported funds. But it this whole industry, the aging industry and the long-term care industry, most certainly will be affected by the cuts if they are made. I don't know the brevity of it. We just got to watch it day by day. Y'all know it changes hour by hour, moon by moon. And so we just really have to watch it. As of now, these benefits are still in play. But again, it's the end of the fiscal year. If y'all call your AAA now, they may say they no longer have uh, funds for the voucher because it is the end of the fiscal year. So just be ready July 1 to apply for those vouchers. So, Valerie, if you could tell me what IHSS is before we close out, I want to answer your question. But I'm thinking you're talking about health and human services in your particular area. Any other questions? Also, I will be in Atlanta on June 21st. So if you know someone who can't come out that Thursday evening, I'll be in Atlanta at 44th and 3rd Bookseller. That is a Saturday afternoon at 3 p.m. I'll actually be joining an author showcase. It'll be me and three other very fine authors. We'll be at 44th and 3rd in Atlanta, Georgia, doing a book discussion and a book signing. You can get your book there. You can get your book on the 26th of June when I am at Story on the Square. You can get it signed and you can buy gifts for other people to share with other family members. So that way everybody knows the same thing who's providing the care for their loved one. All right. Well, I thank you all so much for joining me this evening for our candid conversations and our live with Dr. Macie. I look forward to seeing you at our next live. Continue to post your comments, continue to post your questions under the videos as it relates to your situation, or if you have some insight, please share that with us. I definitely welcome that, and other caregivers welcome that as well. Before I leave, I want to leave something with you. Be the reason someone smiles today. It's going to make a difference, not only for them, but for you as well. I'll see you next time.